I'm Dr. Babak Larian, and I'm going to talk to you today about the evolution of parotid surgery. So, all parotid surgery is being done today and has always been done through this incision called the modified Blair incision, which starts in front of the ear and then goes all the way down into the neck. And this is a fantastic incision because you can lift the skin forward, right, and see all of this area, right, for surgery. And that is really important when you're dealing with a parotid cancer that has spread to the lymph nodes in the neck, right? Because this approach can allow you to remove the parotid gland along with the cancer and then go down in the neck and remove the lymph nodes in the neck. So this lower part of the incision, right, gives you access to the neck. And this is great for a cancer operation, but it's not really necessary when you're dealing with a benign tumor. So traditionally, when we were doing parotid surgery, originally we were removing the whole parotid gland, right? This is the parotid gland, and when you look at the cross section, this is the whole parotid gland, right? And this is the facial nerve in white line going through the parotid gland, okay? And over time, we discovered that we don't need to remove the portion deep to the nerve to remove this tumor. We can just limit the surgery to what's superficial to the nerve, and that's called a superficial parotidectomy, okay? Removing the whole superficial layer of parotid. And then as we got wiser and smarter, we started looking at our data, and we noticed that for the benign tumors, if we remove the tumor along with a little bit of extra parotid tissue around it, the chance of recurrence, the chance of injury to the facial nerve, everything is similar, right? So removing the whole entire superficial lobe was the same in terms of recurrence of the tumor, right? The tumor coming back as just removing this black area. So just removing the black area versus all of this additional tissue, right? So it's an over operation, okay? Just like the incision is an over operation designed for cancer surgery, removing the entire superficial lobe is also doing too much, being too extensive without any additional benefit. The advantage of just removing this black portion here is that it is a simpler operation. You have less exposure of the facial nerve, so there's chance of injury to the facial nerve, easier reconstruction, less chance of Frey syndrome, which is sweating on the face when you eat. And so you can do a more appropriate operation to treat parotid tumors, especially benign tumors. So then, over time, I started changing my incision from this modified Blair, which was too much, to a modified facelift incision. The modified facelift incision is fantastic because it's well hidden in the grooves around the ear and then goes behind the ear and into the hairline, right? Now, it wouldn't work for me because I don't have a hairline, but for everybody else, it does really work well. And in time, I discovered that with this incision, I really have access to everything I need. I can see the parotid gland really well, but I can also see the muscles of the neck that I need to use for reconstruction. So I had everything I needed through this incision. I didn't need to go down through the limb in the neck. Then over time, as I became more and more experienced, I started making the incisions shorter and shorter and shorter. And now my incision is this, which is what I call a micro-parotidectomy incision. In front of the ear and then in the groove behind the ear. In front and in the groove behind the ear. It's well hidden. It gives me full access to all the areas that I need for treatment of benign tumors or the less complex tumors in the parotid gland. And that was a concern for everybody. Is this incision good? And so I'm going to show you a picture of during surgery that I turned into animation. And this picture shows you the earlobe here being flipped up, right, by the retractor. And these hooks pulling the skin on the face has a lot of laxity to it. And This is after the tumor is removed. You can see the facial nerve coming out of the skull here and dividing into the upper and lower division, which go on to multiple branches. And you can see this branching system very well. If I had my incision go down into the neck, it wouldn't add anything to this area of interest for me, okay? So this is an example of this surgery being done. This is time-lapse version of it, right? So these are the probes monitoring the facial nerve, and you can see the incision around the ear. The skin and the earlobe are being retracted with these specialized hooks. The facial nerve is being identified, and then once it's identified, the tumor is carefully being removed from around it. And once the tumor is removed, a reconstruction of the defect is made, and then the skin layer is closed in multiple layers, right? The deep layer first, and now the superficial layer, right? And voila, the surgery is done. And this is the pictures after the surgery is done. You can see the incision in front of the ear lobe and behind the earlobe. And you can see the sutures are all under the surface. They're absorbable and don't need to be removed. And in these simpler cases, I don't even need to use a drain, right? So the surgery is done without a drain when I don't need to use a muscle flap, which is a lot of times, especially if you do the surgery in a smaller tumor. If you come in at a sooner time and I have to remove the smaller amount of parotid, there's no need for the muscle flap or a bigger reconstruction. And this video shows you also, again, same thing, surgery done through the micro-parotidectomy approach. At the beginning, I'm showing you the greater auricular nerve, the nerve that goes to the earlobe that was preserved, right? And then, more importantly, this is after the tumor was removed. The tumor was in this area that was removed, but you can see the facial nerve coming out of the skull right there, and then dividing into the upper division and the lower division there. So it's branching out, right? And I can see those branches very well. And now that the tumor is removed, I have an opportunity to use a nerve stimulator to stimulate the branch and make sure all the branches are working, all the muscles. So I'm going to stimulate the upper division now. You see the upper part moving really well. And then the lower part, and shows just the lip moving. So all the branches are working, right? So the parotid surgery has evolved. Doing a big incision is no longer necessary to get the job done well, safely, and it can be done in a way that your recovery is significantly faster. This is an outpatient procedure. All patients go home on the same day. They can eat. I have them walk the next day, go for walks to get the blood circulating, get the anesthesia medicine out of their system, and get the process rolling. They usually go back to work in a week, unless they're doing heavy labor, and resuming full exercise 3 weeks later. So this surgery has evolved to something much simpler. Hopefully this is helpful. Be well.